Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane. And in this question of the week segment, we have a patient that's had a tummy tuck, looks like in mid-December. And Dr. Pane, they said in the email there that their stomach is very swollen and wants to know how if they have a seroma hematoma. And again, the surgery looks like happened about mid-December, and they're about 6 weeks post-op. So, Dr. Pane, what do you recommend here?
Well, first of all, if you're 6 weeks out from a tummy tuck and there's abdominal swelling, I'm just going to presume there's nothing really serious going on inside the abdomen. If you've been seen by the surgeon and they're not too concerned, then the swelling is going to be due likely to the flap, which is the front of the abdomen that's brought down. Now, seroma is a fluid collection that can happen under that abdominal flap in the space that's left behind when the surgery is done, and that's why the drains were placed initially. The way I do this procedure, I have essentially almost a zero incidence of seroma, but I'm familiar with it because I take care of people. Sometimes they have surgery elsewhere, so I deal with some of those complications. You should get examined clinically to make sure that something, what is going on is accurately diagnosed. If the first surgeon is not giving you a satisfying, if you're not comfortable with that, then you might have to see a second opinion. You usually can tell what's happening under that flap with a clinical examination because a seroma or a hematoma are going to look differently, and the treatment of it will be different. Hopefully, though, in this case, it's just routine swelling and that nothing major is going on. So I encourage you to get checked in person. Regarding the belly button, that takes a number of weeks to a few months until you get a sense of how it's really going to look, because that area tends to swell up both on the inside and in the outside there. So I don't get too concerned with that until you get to about 3 months out. And then from there, if anything needs to be done to improve that, that can always be discussed as a separate item.
Well, thank you, Dr. Pane. And if you have a question for Dr. Thomas Pane, please visit our Facebook page or website. And once again, Doctor, thank you for your time, and we'll see you next week for the next question of the week.
Great. Thanks.